Now the thing is, it's spreading pretty quickly with Omicron going on. So yesterday, as the news was reporting, so the first case in the U.S. was in San Francisco area, and a person was fully vaccinated and only had mild symptoms. The second case was in Minnesota and had a New York link because he attended AnimeNYC on November 19th to 21st. I attended also AnimeNYC, and I also got my booster. So if you don't know, I am a pharmacist. But also I monitor COVID as well because living in New York City, we were the one of the first epicenters other than China back in 2020, and I know how it is, and it's painful, and it's kind of like we're sort of reliving it, even though we're technically not, because we now have the vaccines and we know what it is now. Back in 2020, we didn't know very much, so we had masks, we had face shields, we were wearing gloves, we were told not to. Hey, DJ Nikki's, thank you for coming. I truly, truly appreciate it. This is unexpected. Usually I stream Sunday night and Friday night, just grinding into before I sleep since I got work. Yeah, so thank you for being tested. And, again, for AnimeNYC, I had a great time. I did not know this would transpire to this. But again, that's why we have the vaccination policy. I think what kind of hurt AnimeNYC a bit was that they allowed at least one dose. In New York Comic Con, you have to be fully vaccinated. So even if you got two doses and it's not even 14 days yet or 2 weeks yet, then you're technically not allowed to get to New York Comic Con. You had to be fully vaccinated. You're not fully vaccinated if you got your second shot and 2 weeks hasn't passed since your second shot. If you have Pfizer and Moderna, if it's Johnson & Johnson, of course, it has to be 2 weeks after you got your Johnson & Johnson. I love AnimeNYC, but this is scary because the con has suffered through what happened on Friday. Yeah, so for people who just joined and you didn't hear about AnimeNYC, so AnimeNYC this year got to a rocky start on Friday, where the lines was really long. We had people wait since 8 a.m. Some people 8 a.m. in the morning, and they still haven't gone in, and it's been like 6 hours. Some people wait 4 hours, 3 hours for a long period of time, and the blocks could be as long as over a mile long, and it's been tough, and. I was working on a part 2 of a follow-up. So I did a 3-part review, gave it a 7 out of 10. It was okay. I have one friend who gave a -2 out of 10. Worse than 0. And then I have a couple friends from Long Island who are cosplayers who gave it a 5 out of 10. They weren't big. They don't like crowds. Okay, because they don't like to be squished on. And plus, it's COVID, which we're going to talk about. This is my little briefing here. So I've been collecting all the information. I didn't have a lot of time because today was busy at work. We found out 3 patients got tested positive for COVID. One, I found out, and I got informed by the doctor earlier this morning, and we had to deliver the medications right away. So when the driver came to deliver the medications, I had to go through a protocol where I had to do my best for my driver to avoid contact with the patient. So I had to have her, call and then come by, put the meds in front of the door, and then call so the patient could open the door, basically, and be masked and all that stuff. And she got vaccinated. Okay, so she's good. She's high risk because of her age, so she's a little bit older. Yikes! No wonder that Omarion is not a variant. Omarion, I think, is one of the singers of B2K. It's Omicron. So it's a Greek letter that is an O. Okay. So I actually didn't have. I was really busy trying to go through Omicron. I actually wanted to go over all the variants. I don't even have all the variants in my head. You don't have to memorize all the variants. Okay, just keep track of it. We already know Alpha. That's from the UK. There's a Beta. is from South Africa. There's a Gamma. Gamma, I think, is from Brazil. Lambda, originally from Peru. There's some Delta is still what we're dealing with. This is so far the strongest one. That's the one where it spreads faster and it gets people more sick and it kills more people and it spreads fast. I said it spreads fast. Yeah. So and it doesn't take much to get it. So there's other variants where where it has a potential to escape vaccine immunity or natural immunity, or even the what we call the monoclonal antibodies. And for some, thank goodness, the amount of cases for that is so low. The thing that you have to realize is that if you're not vaccinated, okay, as long as it's able to spread to other people, it has that opportunity to mutate. Okay, if most people are fully vaccinated, we can actually mitigate the risk of that virus from mutating. That's why you hear with polio or smallpox, when you have this mass vaccination campaign, especially there was like so many posts ago, maybe last year, I talked about a little bit of a summary of a time when there was a case of smallpox. Person came in, and the health commissioner actually made a mandate of vaccinating basically almost the entire population in New York City in the 40s. So smallpox would have spread. And thank goodness, there were only 3 cases, including the one who traveled from outside of New York City. So it is possible, and it takes a united team effort to beat this. Unfortunately, we screwed up in the beginning. Okay, so it really takes time to beat this. Okay, even one small misstep, the virus will take advantage of it and capitalize on it. And eventually, if we don't do what we need to do, it becomes what we call an endemic. An endemic means it just lives with us, basically. And then you'll have some outbreaks here and there, just like what we deal with the flu. As long as there are people who are not vaccinated, and even if you don't like the vaccine, if you're not wearing a mask and not socially distancing when you need to, when you're not following all the protocols that work, then you're giving the virus an opportunity to mutate. And it's going to take so much time to fight this pandemic. So again, politics aside, put that all away. What we want to focus on is people's lives, whether it's yours or mine's or people you love, any human being. Okay, it's very important about that, because we're all a family, right? Even though we may not be related, we're part of that human race. It's really important that we all work together. If we don't do this, more people will die, and for those who do not die, more people will suffer, and we don't want to see that. Okay, that this is why I'm heavily invested. I'm very passionate about it, because it affects me as a healthcare professional as well, because a lot of people go through the burnout, but it doesn't stop with me. Okay, it's also with other people. You don't want to lose people. You don't want to lose your loved ones. You don't want to get sick yourself. Okay, just because it doesn't affect you doesn't mean it doesn't exist. All right, and it shouldn't be just that you shouldn't just realize it just because you get it. You should start realizing it once you see it. Very important. So here it is. This is the update so far. I don't know if you're able to see it. Let's see. Yep, we're going to talk about it a little bit. It's not switching. Is it switching now? No. It's okay. All right. It affects my mental health because I can't stand being away from people, and that I can thrive off of visiting friends. So, exactly. Because people, again, you got to mask up, okay? Even if you're vaccinated or not. All right, I'll explain, and I will have to remind people why vaccination is just one layer of it. Just because you're vaccinated doesn't mean you put all your eggs in one basket and you become invincible. No one's invincible, all right? Even if I don't know who played Sonic games back in the Sega Genesis, Sonic 1, 2, and 3, or if you played any of the Super Mario Brothers, there's this invincibility thing. You can still die, technically, even if you're invincible. Or, if you're playing one of those Sonic games, if you're Super Sonic, you're like that continuous invincibility, you can still die with it. Whether you fall into some kind of a cliff or if you get squashed by something, or if you're underwater, if you're Sonic, if you're underwater, even if you're invincible, you can still drown. So there is no such thing as invincibility, basically. Everyone's, susceptible with it. I don't know why this thing is not, but anyway, so you're supposed to show the part with the update here. So I don't know why that's showing, but I'll get to the vaccines a bit. So I'll talk about the updates. So the first Omicron case in the U.S. was in the San Francisco area. That was as of 11/28, so November 28th. So that person's fully vaccinated. The person had mild symptoms, and person is recovering. Second case, as you know from my stories on Instagram, is a person from Hennepin County, Minnesota. That's around the Minneapolis-St. Paul area, who went to AnimeNYC. That's the cons that I think Nikki went to, Alex went to. All right, that's one of the first large conventions that's being held in the tri-state area since the start of the pandemic on November 19th to 21st. This person got tested positive for Omicron on November 24th. So the person actually started feeling the symptoms on the 22nd, the day after the day 3 of AnimeNYC. This person, last time I checked, is fully vaccinated and boosted. And also, this person has since recovered. The third thing is that after the news of after the news of the person who traveled from Minnesota to AnimeNYC, there were 5 confirmed new cases in New York State. So here it goes. First one is a 67-year-old woman in Suffolk County in Long Island. So this person got at least 1 dose. Second person, then there are 2 who are from Queens and unknown vaccination status. And then there's one from Brooklyn, unknown vaccination status. And then there's a 5th one. We don't know which borough. It looks like, according to Channel 11, it's Manhattan, but we're not sure yet. This one's a traveler, so this one is, and vaccination status is unknown. So that being said, for New York City, the vaccine mandate has expanded also to non-public school employees. That's in addition to public school employees. So in this case, for non-public school employees, your deadline is December 20th. Okay, so that's very important. I also showed that I showed my proof that I was tested negative. So even though I went to AnimeNYC on November 19th and 20th and 21st, 19th it was only nighttime because I went after work. I wore a mask at all times except when I was eating. And, even though there were a lot of crowds, there were over 53,000 people, I also got my booster. So I got my booster on October 23rd. So got my first dose for Moderna mid-January. I think it was January 16th. And then the second dose, February 13th. And then I got my booster on October 23rd, which was about 1 or 2 days after the United States approved the boosters. So now we're still collecting information on that, still new. And so as I said to a few people, this Omicron variant has at least more than 20 mutations on the spike protein, the one that pierces through into the human cell in order to enter. And then there is on the ACE2 receptor at least 10 mutations. And the thing is, though, even though there are mutations, there's a possibility that it could have many changes. But the thing is, everything's preliminary. What they're fearing is that it could escape vaccine or natural immunity, or even the what we call the monoclonal antibodies. So Moderna is actually a little concerned about that. Now, again, we don't have the full information yet. So any protection is better than no protection. So if you're eligible for the vaccine, please get it, please. And if you already got fully vaccinated, please get boosted. And I will actually talk about it on this slides right now. So we're gonna go get started. Okay, so COVID vaccines, they're safe and they work, but it's your call. But now there's some growing evidence where it's not only safe, but it's really very important. So I'm heading towards this vaccine mandate thing, unless of course you have an allergy to any component of the vaccine. Okay, or of course if you have a conversation with your doctor. All right, so a strong layer of protection that's are provided by the vaccines, even though it's not 100%. So, in the next few slides, I'm going to talk about the Swiss cheese model. I talked about it. I think it was on my very, very first stream, but I think it bears repeating, it bears emphasizing, and it bears it bears repetition, bears emphasizing that this is really important in order to protect yourselves. So, strong layer of protection, even though it's not 100%. Okay, you have to do everything else as well. So you can have multiple layers, so you can increase your chances of not getting COVID. So in the United States, we have Pfizer, Moderna, and Johnson & Johnson. As of last month, those ages 5 and up are eligible for vaccination. So keep in mind that for Pfizer, you'll see a name called Comirnaty. That's the Pfizer vaccine. It's approved for those who are 16 and up. Again, 16 and up, because they have enough data for that. There is an emergency use authorization for those who are 5 to 15. Okay, so the 5 to 11, they get the 1/3 of the dose because their immune systems are much more robust. If you give any higher, then they're going to get side effects. For those who are 12 and up, they get the full dose. So, as you know, you heard me say all the time. If you haven't, I'll go over it again. If you have Pfizer, so it's 2 doses series, and it's 3 weeks apart. Moderna and by the way, Moderna, it's not fully FDA approved, it's just emergency use authorization, even though it's almost the same thing as Pfizer. It is 4 weeks apart for the 2 doses. For Johnson & Johnson, it's 1 dose. But again, we're going to talk about boosters in a little bit. So, for these, how should I put, for those who are eligible, this is how it goes. So if you're immunocompromised, and this only goes for Pfizer and Moderna, you get your booster 28 days after your second dose. It's one of the few exceptions. So those with allergies unrelated to vaccines, always bring an EpiPen just in case. Okay, so those who are allergic to any food, pet dander, venom, eggs, latex, gelatin, etc. Okay, that doesn't mean you are not eligible. You're actually eligible. So especially with the mRNA vaccines, those are the Pfizer and Moderna. Those who have underlying conditions that increase the risk of COVID do not make you ineligible. You can still get the vaccine even if you have underlying conditions. If you're actively sick, like if you have COVID, with the symptoms of COVID or the flu, if you have a fever, then do not take the vaccine yet until you are fully recovered, because your immune system is still busy. Okay, so those with a history of vasovagal reaction, so those who faint, they're not exempt from it. Those who have autoimmune disease and blood cancers, you discuss with your provider. So a while back, Colin Powell passed away, even though he was fully vaccinated, but he had multiple myeloma, so that affected his ability to fight COVID because his immune system was already compromised due to that condition. Those with Bell's palsy, Guillain-Barré syndrome are not exempt. Those who have COVID in the past, you're still eligible as long as you have recovered for it and you're healthy and you're not sick from COVID. Those who are pregnant and nursing, the shots are safe. Okay, just make sure it goes through. Okay. So when should you wait as opposed to getting it as soon as possible? So as I said, if you're sick or if you have a fever, so greater than 100.4 degrees Fahrenheit or 38 degrees Celsius, so you have to wait until you're fully recovered. If you have MISC or MISA, so it's a multi-inflammatory syndrome. The C means child, A means adults. You gotta wait until after recovery or 90 days from diagnosis. And recent therapy with monoclonal antibodies or convalescent serum, so you wait until 90 days after therapy. Who is not eligible, things can change. So now, as I said, those are under 5 because we don't have the data yet. Those with serious adverse drug reactions to specific ingredients or after first dose, and reaction can occur 15 to 30 minutes after vaccination, or severe enough to require EpiPen, so your hives, wheezing, and if you have trouble breathing, if you have any swelling, or anaphylactic reactions, and so these those people are not eligible. If you have an allergy to any component of the vaccine ingredient, such as polyethylene glycol, okay, and this is not antifreeze, just letting you know, or polysorbate, for example. So myocarditis, pericarditis, I talk with a cardiologist or your primary care physician. For many cases, it actually subsides over time, but again, always have that kind of conversation. So here's the booster guidance. As of it says November 2021, but it's actually pretty recent. So those who are 18 plus, so who are 18 or older, all adults are eligible for booster shots. But in order to get a booster shot, you have to complete either series. So if you got Pfizer or Moderna, okay, you have to get your first dose, and then if you have Pfizer, wait 3 weeks later, get the second dose, or if you have Moderna, wait 4 weeks to get the second dose. All right, to get the third dose, the booster shot, you can take any 3, at least 6 months after the second dose, because that's approximately the amount of time that the vaccine immunity wanes. So those who you should put more priority on are those who are 65 and older, so they tend to have weaker immune systems. Those who are 18 and older who work in high-risk settings, like me. So I work in pharmacy, so you deal with the public. Those who are in healthcare settings, hospitals, long-term care, healthcare field, or those who have underlying conditions. So if you have diabetes, if you have cardiovascular-related issues, if you have respiratory-related issues, now they added mental health issues, so that could be a risk, increasing your risk for COVID. If you have the Johnson & Johnson vaccine, that's a single dose, those 18 and older can get any 3 boosters at least 2 months after the first dose. Okay, so there was one study where Johnson & Johnson did a booster 2 months after the first shot, and it was compared to taking 2 shots of either Pfizer or Moderna. So you already know that usually indoors, especially indoors now, okay, such as trains, planes, buses, all those things, you have to wear a mask in those places. So those are the modes of transportation. But now in indoor public spaces, it's very important that you wear a mask. If there are crowds, whether it's inside or outside, you must wear masks, just like in AnimeNYC. So this is the chart. This is the Swiss cheese model. And this is why vaccination shouldn't be your only layer. You should do all the other layers, okay? Since multiple layers of protection decrease the spread of the virus. So it states that no single intervention is perfect. And that's why you still have to have a mask. Got to get your education, of course. You gotta know about the virus. Gotta be vigilant. There's your testing and tracing. Try not to touch your face. Wash your hands. Social distancing, hand hygiene, masks. You limit the crowds. Actually, sometimes not always realistic. So, but if you're able to, great. If you improve the air purification, filtration, ventilate. If you improve ventilation, if you go outdoors, that will help you reduce the chance of getting COVID. Not all of them are perfect, but when you add more layers and you strengthen each of the layers, then you will have a better chance of not getting exposed, and not only that, not spread it. So domestic travel, so things will change with this one. So if you're fully vaccinated, great. You still have to wear a mask, as I said, with modes of transportation, and if you're going into indoor public places. So until you're fully vaccinated, it's best to delay travel so you'll less likely spread it or get it. And there's no need to quarantine unless if you have symptoms. So those fully vaccinated, you still have to follow safety precautions, just as if you're going into an indoor public setting where there's a lot of crowds, or even if there's crowds outside. Okay, and even when you're traveling, gotta wear a mask. And this will go on, I think, through part of next year. We don't know what the future holds because we're still collecting information. So as I said, with the social distancing, you're tired of it already, I know, and with the hand washing. And, when it comes to all these protocols, go for the strictest and safest. So, okay. So one of the updates is that for international, which I'll get to in a bit, and when you're going to the US, you got to get your PCR test within 24 hours prior. So some people will say, oh, it should be 3 days. But yeah, the day before you leave, make sure you get a negative test, or else you're not flying into the US. But with domestic travel, if you're fully vaccinated, unless if you have symptoms, you don't have to get tested. So now you have to avoid, if you're unvaccinated or partially vaccinated, please avoid those being around those who are high risk of COVID for about 2 weeks. Some people say 10 days, but the longer the better. You want to make sure you're safe. Monitor for symptoms, isolate and get tested if you have symptoms. And if you're unsure, follow which ones, always go for the strongest and the safest. So international travel, do not travel until fully vaccinated, of course, okay, because the variants are increasing. The mutations are going on probably on a monthly basis. It just doesn't stop. And so I may post these updates probably on Instagram. We'll see how, I'm going to go through all the data. So you already know about the mask. You already know about following CDC travel guidance and restrictions. So they put restrictions on Southern African countries, including Botswana and South Africa, due to the Omicron variant. I'm surprised they didn't put other travel restrictions all over the world, because it's not just limited to Southern Africa. It's also Netherlands, it's Germany, and then now there's Saudi Arabia, and then there's UK, and then last time I checked, there were 2 in Ontario, Canada, and 1 in Quebec for the Omicron cases. So, as I said, get tested 1 day before travel and about 3 to 5 days after travel, simply because you have to do it with PCR. It's the gold standard. The problem with doing a PCR a little too early is that it may come out as false negative. So be careful with that. You can and you'll have that false sense of security. You'll like, I'm tested negative, but you have to test again just in case. Okay, because there are people who are asymptomatic, as I hope people would know already. You can have symptoms or you can have no symptoms and still be test positive. Okay, so there's no need to get tested before leaving the US unless of course the destination says otherwise. And unless if you're symptomatic, you don't need to quarantine. Okay, now as I said, for AnimeNYC, there was one case of Omicron, and the great news about it is that not only this person got vaccinated and boosted, it's required to have at least one dose, and they had in order to attend AnimeNYC, and you had to also wear a mask as well. So if it were last year before the vaccines came out, this would have been a super spreader event, and the cases would have went up drastically. So this is international travel. So a lot much hasn't changed too much. Not a lot has changed except for the fact that you have to get a PCR test the day before you leave. It says 1 to 3 days, so that's already changed. So if there are any updates, I'll generally post them on Instagram. And if you're flying before arriving to US, you must have proof of negative test no more than 1 day before travel, or proof of recovery from COVID in that past 90 days, regardless of vaccination or citizenship status. Okay, I'm heading to bed now. Have a great stream. Stay healthy. You too. Thank you so much. Hi, Kat. Sorry. I was just looking at the thing is I was going over the slides. In order for me to move the slides around, I wasn't able to see the chat. I think that's why there are people who have two screens. I'm using a laptop. So I hope you can hear me and all that stuff. Tell me what you think about it. All right. Again, this Omicron variant is still new, so I'm still studying, still going over the information with the press conferences from Governor Kathy Hochul for New York and also for Mayor de Blasio. Don't be scared, okay? Everything will be okay. Don't panic. Panic isn't going to solve anything. Cool heads prevail. Okay, if you're fully vaccinated and you're good, I'm probably going to get tested this Saturday as well, even though I got tested on Sunday, the 28th, a week after the day 3 of AnimeNYC. I was tested negative. So, Kat, did you get your third dose? Oh, you don't have the boost. Okay. So I don't know if you got this, but I got my vaccine January 16th, February 13th this year, and on October 23rd, I got my third dose. It was about 1 or 2 days after the United States approved that for Moderna. Pfizer was always the first one. I don't know why Pfizer is so aggressive with it. It's like Moderna and Johnson & Johnson. They're just stuck with the emergency use authorization thing. All right, so moving on. Actually, that's about it for that. And so that's my little. Those are my little slides. I'm actually gonna go over a few information here. So yeah, so any protection is better than no protection, and I'm speaking to the people who are unvaccinated. I've been going to the city a lot, and people won't wear my mask at all. Yes, I know. I went to church for the first time in a while in person because I used to do it on Facebook, and about 90% of people are not wearing masks because they think, oh, I'm vaccinated, I don't have to do it. No, just because you're vaccinated doesn't mean you're invincible. Okay, you can still what we call breakthrough infections, and we can fight against breakthrough infections. Okay, I know you don't like masks, but you still have to wear a mask. Okay, wear a mask. Do your best to social distance, even if it's not realistic to social distance. You still have to wear a mask, as I said many times. Try not to touch your face too much. Yeah, horrible. I hope this thing won't get. I hope it doesn't get worse as well. I have some people telling me that, oh, the cases are mild and yeah, so what? It's preliminary. You never know. And so far, some of them are those who are fully vaccinated. For those who are fully vaccinated, they can actually weather the storm. Basically, it's the unvaccinated and those who are high risk and those with underlying conditions. Those are the people I'm really worried about. It can go to 0. Yeah, I've seen it. because I was on the front lines. I don't know if that's considered front lines, right? I work in a private setting in the pharmacy, and even though people were staying at home order, I still had to go to work. And yes, I am. You're an essential worker too, basically. But you know, I had to physically show up, and I have to tell you, taking the subway, I don't know. I don't think it really feels scary. It just feels a little eerie. I don't think it's scary. You're working home throughout the pandemic. I don't know how that works. Like, being a counselor, other than just doing Zoom or speaking on the phone. That's what I've been doing with my therapy. I've been on the phone, so it's been a while because of the holidays and of course AnimeNYC. And I'm a little nervous because AnimeNYC via Google Meet. Okay, great. So AnimeNYC is my hometown anime con. New York Comic Con is my hometown regular con, and I want them to succeed. It's like you're rooting for the home team. And it's AnimeNYC has gone through so much. Okay, from their Line Con Friday and the issue with the One Piece panel line, the One Piece screening of the 1000th episode, and all these criticism I have during my 3-part stream. I had a part one. Actually, well, yeah, I had a 3-part for the review, and then I had a follow up part one, and it was on the staffing who are rude, and it goes for both AnimeNYC staffs and the Javid staff. Yeah, it was crazy. I heard, yes, exactly. And I was planning to do a part two of the follow up, and this was in response to Peter's message about it. And I'm still working on that. I know people think, oh, I can do a post in a few seconds. It does not work that way, especially for me as an autistic, okay? Reason being is that I think very deeply, and, I can't rush things because I like to. It's like writing an essay because you want to make sure everything flows and you have all your thoughts in. Because if you rush it, then you're going to forget to put things and all that. And it's going to seem a little wonky. But if you put preparation into it, if you think about it deeply, if you get things organized, it'll run more smoothly, at least for me. And I can get all my thoughts out. But if you rush, you may forget several more thoughts. We don't want that. So maybe part two of my follow-up for the review, I'm going to add that plus the Omicron variants. So keep in mind, 53,000 people went to AnimeNYC throughout the 3-day event. And I never thought this con would be all over news outlets like this, especially because of this person from Minnesota who went to AnimeNYC and got tested positive. Same, yeah, exactly. And if in case you missed it, I said that there are at least 5 cases in New York that are reported. The actual, we don't know. There's probably a lot more. The status is unknown for the time being. I know for the one in Minnesota who went back to Minnesota, he has fully recovered. So there's more. I mean, if there's smoke, there's fire. I'm sorry, but expect the numbers to go way up. All right, and maybe not as far as like last year because we didn't have the vaccine. Now we have the vaccine. Problem is now we have all the misinformation, so it's another battle, and it's layer over layer of complexity, and it's a little scary. So I understand if you're scared. I don't feel too scared. I'm just more concerned and vigilant because I don't want to see patients or any of the people I know or anybody for that matter to suffer through this. I already found out 3 patients of mine at work got tested positive. The first one is actually someone who's a delivery person. Okay, but he's a patient nonetheless. The second one, I got the call from one of the doctors, and I was given the medications, and I had to administer it for that patient. And I had to devise a quick COVID protocol where I cannot have the driver get in contact with that patient. You just leave it by the door and then have the patient open the door and pick up the medication. I really hope people, exactly, I hope people take the right precautions. So far, I think people are tired. They got the COVID fatigue. I'm fatigued as well because I'm on the front lines. And, we don't want more spikes. It's been busy ever since the end of summer at the pharmacy, cat. And people, people are getting sick, and people are getting allergies now. The flu, I haven't seen the flu cases yet. I think that's gonna go up as well compared to last year, simply because the restrictions have been lax. Not a lot of people don't want to wear masks and all that. So it's to be continued. I'm monitoring this, and actually, let me see if I have updates here. So President Biden is going to have a. Are the symptoms are the same before? So that's we're still being worked on. So let's just so COVID is COVID. So so far it's mild. Just because it's mild doesn't mean you go let's relax, let's it's fine, it's nothing. No, 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 no. Because it can change, as you said, it can go from 0 to 100 very fast. Okay, that's what we've seen last year when COVID originally was discovered in China. So even though it went to the west coast of the U.S., it went to Europe and then it mutated. And then after it went to Europe, we didn't put any travel bans on Europe. We only put travel bans on China, but it's already spreading around the world through travel. And then it came to New York, and we were the epicenter right after China, just like that. Even though they're saying they were an epicenter for, I think, in Italy or France. I remember back in last year, but we got hit very hard in the. It's not just like New York; it was New York City tri-state area. We were the epicenter, and at one point, New York State had the most COVID-19 cases. It had more cases than any other country last year, except for of course, the U.S. Those were hard times, and we don't want to go back to it. Those are really sad times. I had to be in house arrest downstairs in the basement, and I remember I had to go straight to the bathroom after I arrived home because at the time, again, there was no vaccine. We didn't know too much about the virus. We had to wear gloves. I at one point had a mask and a face shield, so I had to protect myself because I have asthma as well. So those were crazy times. Now we know that it doesn't spread as well with surfaces. The risk is still low, so it's more with respiratory droplets. So it goes airborne. So that's the one we're worried about. So now, the main thing that we're worried about is the transmission. So from what I'm seeing with South Africa, it doubled. Okay, a few days ago. So I have to look at the latest numbers, but it's going up. But also, it could be the fact that about roughly 25% of South Africans are vaccinated, and there's a lot of unvaccinated people to be spreading to. So the virus has a lot of opportunity to mutate. Again, in order for a virus to mutate, they have to infect a host, which in case a human being. Okay, without infecting the human being, then it wouldn't be able to mutate because viruses don't do anything. They need the tools of a host cell in order to replicate. Yes, I know. I tried to make it as easy as I can because everything is so technical. This is in the healthcare field. It's like a different language. So I'm just actually checking the notes here. So this in the holidays. So again, more people are traveling, more indoor gatherings. Of course, no masks, but I'll be wearing a mask. Okay, so that would lead to higher cases, more hospitalizations, and then more stress on the healthcare system. So again, get vaccinated, get the booster, get tested. I got tested this past Sunday. If you're sick, you stay home, quarantine. You wear a mask in indoor public places. I wear a mask everywhere I go except for my own room. you wash your hands as well. Also, what I'm very thankful about New York City is that there are mobile testing vans and mobile vaccine vans or buses. Okay, I know DJ Nikki's already sleeping, but he he was he I when we went back to, I always have my mask too. I always take it off when I'm eating. Yeah, exactly, or when I'm drinking. I just put the straw under, like that. So he was upset when he arrived back to California, DJ Nicky Zam, and because it was very hard for him to find a testing or vaccine site in New York City. It's all over the place. So I guess I took it for granted. So so far as of today, we have at least one case in Hawaii, California, Colorado, and Minnesota. But that's only reported cases. There are cases that are not reported. So, as I said before, when it's in, if a first case comes in, yeah, I thought they have resources too. I don't understand. This is the United States of America. What is this? Okay, some people are are luckier than others. It's ridiculous. We got a lot of money, so we need to treat our citizens much more, much better than this. So, I talked about the cases. There are four in New York City, one in Long Island for the Omicron cases. Okay, and so there's also the winter strategy that President Biden's doing. So there's going to be more information soon. So he's thinking of bringing at-home rapid tests. I'm not a big fan of those because, especially if you don't know how to use it properly, you may get a false positive or false negative. I would do it at a mobile testing van or a mobile testing site, with professionals. So you have a accurate reading. So they have the free tests, 50 million free test kits for uninsured or Medicaid. The ones in New York City that's run by the city clinics, it's free. Okay, so now, and I guess that's about it. Again, thank you so much for joining. Thank you, Kat. I know it's a little late. It's 12:25 a.m. I truly appreciate you joining, even though you're my mod as well. Okay. I may do more of these kinds of mini briefings and try to get some more information out of it. I'm still stunned, shocked, and surprised that we went to AnimeNYC and not knowing this one was that we have a person with the Omicron variant. We didn't even know what Omicron is. I learned about it in Thanksgiving. When it was B1.1.529. I started, yeah, you saw my Instagram, so I started doing this. Oh, we got a new variant. Thanksgiving night when I was in Long Island. So I'm on it. I'm passionate about it because I don't want to get it. I don't want you to get it. I don't want anyone to get it. The people who are following it, I hope, please don't die on me. Please, please, please. Okay, we got to do this together. We're all in this together. We got to fight. We got to fight this. Because thank you so much for the feedback. And the hardest part was really trying to put the information together because it's time consuming. I'm still gonna do it. It's just so much information. I think once I have all the enough information, I'll go through it and try to do an abridged version of it. That'll be great. So, but for the time being, to be continued. I hope everyone is healthy and safe, as Nikki has said many times. All right, I'm gonna see if I can raid someone. Who can I raid to? Oh, Junipat. Oh, this is actually it's a tag team. Like, they're a married couple. They run the Twitch together, and so I will pass it on to them. So, in the words of DJ Nicky Zem, have a great day or a great night. And I hope you all stay healthy and safe. And I will send you to the raid right here. I think I spelled it right, did I? Yes. Okay. So more information coming up. Hope I know this. Even though Twitch you do the gaming, I'm a little bit different. Soon I'll do the gaming. So hope you have a great night. I'll see you then. Bye. Peace.